5 digestive symptoms Indians ignore until it is too late. In India, people are experts at ignoring symptoms by just assuming it's gas because they've eaten outside, it's acidity, it will settle down. As a gastroenterologist, I see everyday different issues. Many serious digestive issues don't start dramatically, they start quietly. In this video, I'll explain the 5 digestive symptoms that many people ignore and the science behind why ignoring these 5 symptoms can be dangerous. Please subscribe to this educational channel for more digestive health videos. Why early symptoms matter? Digestive diseases often progress in stages. Let us say, for example, colon cancer. It begins as a small polyp. It can take years to become cancer. Simple fat deposition in the liver starts to worsen over a period of time from grade 1 fatty liver to grade 4. Eventually can lead to fibrosis and cirrhosis. Mild acidity reflux can turn into gastroesophageal reflux disease. It can remain chronic in some people. Early stages cause mild symptoms, but later stages cause complications. There is enough scientific data that shows early detection can dramatically improve outcomes. Let us simply take example of colon cancer. If you can detect colon cancer early, there is over 90% survival rate. If you detect late, your chances of survival drop so substantially. Delay can change prognosis, delay can cost lives, unfortunately. The top 5 symptoms one should not ignore. First one is blood in the stools. It is so common for people in our country to assume it is piles. Yes, piles are common, but blood in the stool can indicate other disease. It can indicate ulcerative colitis, it can indicate Crohn's disease, inflammatory bowel disease. It can indicate polyps in the colon, little growths. It can indicate colon cancer too. Any bleeding from the gastrointestinal tract means there is an issue. Red flag, what we call as the alarm bells, should ring if you are noticing blood that is mixed with the stool happening frequently. If the stool is very dark and like tarry, black, if your blood count hemoglobin is going down, if you got a family history of colon rectal cancer, if you're aged above 40 and having symptoms, colon cancer is rising fastly in India, especially in cities. Ignoring bleeding repeatedly means you're allowing the disease to progress. Simple examination like colonoscopy can detect the problem, remove the problem including polyps and also early cancers. Inflammatory bowel disease that can be picked up and treated promptly. Secondly, persistent acidity. Occasional reflux, occasional heartburn, anybody can get. Symptoms going on for weeks to months might indicate problems including the gastroesophageal reflux disease or Gerd. If you are getting acidity, reflux 3 days out of the week, that then becomes the disease, the gastroesophageal reflux disease. You may have ulcers in the stomach, in the esophagus, in the duodenum. You might be harboring this H. pylori, which is such a common bacteria in our country that causes variety of problems including chronic gastritis, gastric erosions, ulcers, duodenitis. Unfortunately, for some people, persistent acidity can also be a sign of gastric cancer. Chronic acid exposure, of course, can damage the lining of your food pipe, the esophagus. Repeated damage, repeated injury starts to create inflammation, irritation. So it can cause changes to the cells in the food pipe and leads to what we call as Barrett's esophagus, which is a precancerous condition. If you, on top of it, have other risk factors like being obese, overweight, eating too late at night, smoking, drinking alcohol regularly, chronic antacid dependency without getting proper evaluation. These put you at a higher risk of having problems which can lead to complications. Just popping antacid, self-medicating without a diagnosis for months to years can mask symptoms. Third symptom, unexplained weight loss. If you're losing weight without trying, let us say 5 to 10% of your body weight you lost within months, within 6 months. This becomes very significant because when nutrients are not absorbed properly, when there is inflammation going on in the body, the metabolism shifts. There is loss of appetite, there is chronic inflammation, there is muscle breakdown. Weight loss without intention, without an effort is never going to be a good weight loss. This requires evaluation because there are a variety of reasons for it. This could be malabsorption, where certain conditions are interfering with absorption of nutrition in your body. You might have chronic liver disease. You might have chronic pancreatitis, chronic gut infections, inflammatory bowel disease. Weight loss is also one of the major alarm symptoms of variety of cancers. We also see many people in gastrointestinal practice with TB in the gut. A lot of people wouldn't even think about TB. How can it be possible in the gut? TB can mimic any disease, including cancer. Patients we see evaluated for weight loss sometimes having TB in their large intestine. Such a dramatic response to the treatment they get within 1-2 months. Fourth symptom, one of the most common symptoms people keep on dismissing, is chronic bloating and the so-called gas. It's the most common symptom in our country in any gastroenterology practice. Persistent, significant bloating that is continuing can be for a variety of reasons. Excess of fermentation of carbohydrates that's happening, that leads to the gas production. When there is more gas in the intestine, you feel more distended, heavy. In some people, there is high amounts of bacteria sitting in the small intestine, SIBO, hydrogen. Simple breath test can help diagnose this. Chronic bloating affects people's quality of life. It should never be normalized. There can be simple reasons that we can detect by non-invasive methods, including the breath test. For example, lactose intolerance, SIBO, IBS, celiac disease, gluten allergy. All these conditions we can pick up and treat properly. In women, sometimes they might have large ovarian cysts that can also be causing the bloating. Persistent distension of the abdomen sometimes means that there can be fluid inside, which is never normal. The last one is the change in the bowel habit. A new change in your bowel habit is relevant, especially for people above the age of 40 or with a family history of colorectal cancer. It should never delay, because structural lesions in the colon, if there is a growth in the colon, it can alter the way the stool is passing. Sometimes the stool can be pencil thin. Some people have worsening constipation despite eating a healthy diet, despite taking adequate water, despite regular exercise. They never had it before. If it is getting worse, it should not be ignored. If there is a new onset of diarrhea, you should not be dismissing, saying it's food poisoning, especially if it is going on for weeks to months, and keep on taking curd rice thinking it's going to go away. There could be inflammation in the lining of the gut that can be causing that. Some people alternate between constipation and diarrhea. This has not happened to them before, and if this is going on for weeks and months, then this kind of a new change in the bowel habit that persists in people above the age of 40 means their gut is telling that something is not right. So I've already addressed in my previous video that people say, doctor, my blood tests are all normal, so I don't really think there is anything seriously wrong with me. Early gastrointestinal disease, you can have normal blood checkups, you can have normal ultrasound scan. Sometimes beyond these tests, we might have to require further tests based on specific symptoms. So there is no like one size fits all approach. Why people ignore symptoms in our country? Because there is fear of procedures, fear of coming to the hospital, thinking that they might find something. Then you don't want to face the reality. Secondly, people are embarrassed to talk about their gut symptoms, passing blood from their back passage, or having change in their bowel habit, excess of gas, flatulence, worsening constipation or diarrhea. People are not comfortable talking about these things. There is also this culture of self-medicating. Just because a friend, auntie next door, uncle nearby, or somebody has had abdominal pain, they took some pill and they got better. So now you also start taking the same pill. Abdominal pain can mean different in different people. There is also high dependency on home remedies. Yes, for a short while it is okay. Try it for a few days. A lot of young people make this mistake that digestive health issues, cancers, or in older people. We see so much of gastrointestinal disease now in younger people, including children. Digestive diseases do not go by your age. So to summarize, if you are noticing blood in the stool, persistent acidity, unexplained weight loss, chronic bloating, change in the bowel habit, and this is all happening frequently and going on for weeks to months, these are not minor inconveniences. These are signals that your digestive system is warning you that there is something not quite right with you, and this requires gastroenterology input, because early detection saves life. If you delay the disease detection, unfortunately, complications can be very unpleasant sometimes. Our focus in Bangalore Gastro Centre Hospital is not about just the diagnosis, but also how to prevent the disease. So please do subscribe for science-based digestive health videos from this channel. Thank you.